typically happens in the specialist's clinic?
So when they see a specialist, so usually some blood tests and urine tests will be done to basically look whether there's any protein in the urine. At times, the doctor may advise that they may have to do a 24-hour urine collection. So this gives us a much more accurate quantification of the amount of protein in the urine. There will be also some tests to look at some of the whether there's any abnormalities in the immune system that may be causing the inflammation in the kidney cells. We will also may consider sending the patient for what we call a CT urogram. This involves a CT scan where a dye is also injected into the vein to basically look at the urinary tract to see whether there's any stone or whether there's any tumors. And finally, depending on the history and the evaluation, we may actually get a patient to see a urologist to get what we call cystoscopy. Basically, is where a tube is passed into the bladder to basically have a visualization of the bladder to see whether there's any lesion there that may be causing the bleeding. So that's roughly the whole entire comprehensive evaluation. But not all patients may require everything.
And so if all things turn out fine, how frequently should a urine analysis be repeated?
So I think, as I say, the key importance is that if there is no protein in the urine, if the kidney function is normal, and the patient's blood pressure is well controlled and there's no other symptoms, most of the time we can monitor the urine analysis at either 6 monthly or even annually to quantify the protein in urine as well as the kidney function.
Right. Finally, reducing one's risk of passing blood in the urine all boils down to preventing the underlying cause of it. So how do we actually keep our kidneys healthy? Does drinking cranberry juice help, for instance?
Cranberry juice has been touted to help with urinary tract infection, but that it's only one cause of blood in the urine. And if a person does not have frequent urinary tract infection, there's really no need to drink loads of cranberry juice. I think that the kidney is the main excretory organ in the body. So I think if one takes a healthy diet, make sure they do not take excessive salt because that may increase the risk of high blood pressure. And in patients who have diabetes, to control their blood sugar, these are basically measures to actually protect the kidney's well-being. The main causes of kidney failure in Singapore is diabetes followed by hypertension. And if these two conditions, if the patient ever do have them, are well controlled, then the kidneys, function will be very much well protected.
So it's all about taking a holistic look at your lifestyle and living a healthy lifestyle. Really. So thank you for those tips, Dr. Liu. And I think we've all learned a bit more about protecting our kidneys and knowing when to see a specialist about blood in the urine. We've just been speaking with Dr. Adrian Liu of the Kidney and Transplant Practice. Thanks for joining us.